Assalamu alaikum, welcome to Pediatric Case Review. In this episode, we will dive into the differential diagnosis of inflammatory bowel disease among pediatric patients. Let's begin. Case number 1. A 6-year-old boy presents with a history of painful bowel movement and bright red blood on the toilet paper. His mother reports that he has been avoiding going to the toilet because he is afraid of pain. On examination, a small tear near the anus is observed. Which of the following is the most likely diagnosis? A. Irritable bowel syndrome. B. Anal fissure. C. Ulcerative colitis. D. Intestinal parasitic infection. The correct answer is B. Anal fissures are characterized by a small tear in the lining of the anus, often caused by passing hard or large stream, leading to painful bowel movement. The presence of bright red blood on the toilet paper and pain during defecation are typical symptoms of anal fissure. Anal fissures are common in children and are usually diagnosed based on symptoms and physical findings. Other options like irritable bowel syndrome, ulcerative colitis, and intestinal parasitic infection generally present with more systemic symptoms and don't typically cause isolated anal pain and bleeding. Case number 2. A 9-year-old girl presents with intermittent painless rectal bleeding. Her parents report noticing small amounts of bright red blood on her colonoscopy reveals a small pedunculated lesion in the rectum. Which of the following is the most likely diagnosis? A. Hemorrhoids. B. Polyps. C. Crohn's disease. D. Anal fissure. The correct answer is B. The finding of painless rectal bleeding and the identification of a small pedunculated lesion in the rectum during colonoscopy are indicative of polyps. Polyps, especially juvenile polyps, are common in children and are usually benign. They can cause bleeding but typically don't cause significant pain or other systemic symptoms. Other conditions like hemorrhoids, Crohn's disease, and anal fissures usually have different presenting symptoms and findings. Case number 3. A 5-year-old boy presents with painless rectal bleeding. He has a history of several episodes of similar bleeding in the past. A technetium scan shows an ectopic uptake in the right lower quadrant. Which of the following is the most likely diagnosis? A. Meckel's diverticulum. B. Ulcerative colitis. C. Intestinal polyps. D. Gastroenteritis. The correct answer is A. Meckel's diverticulum is a congenital condition caused by the incomplete obliteration of the vitelline duct. It can lead to painless rectal bleeding, often in young children. The technetium scan or Meckel's scan is a specific diagnostic test that shows ectopic uptake of the area in the diverticulum, confirming the diagnosis. This condition is distinct from ulcerative colitis and intestinal polyps and gastroenteritis, which present with different clinical pictures and diagnostic findings. Case number 4. A 4-month-old infant, exclusively breastfed, presents with blood-streaked stools. The baby is otherwise healthy and growing well. The mother reports no changes in her diet or the baby's routine. Which of the following is the most likely diagnosis? A. Lactose intolerance. B. Milk protein-induced proctocolitis. C. Infantile gastroenteritis. D. Allergic colitis. The correct answer is B. In exclusively breastfed infants, milk protein-induced proctocolitis is a common allergic reaction to cow's milk protein present in the mother's diet. It presents with blood-streaked stools in otherwise healthy infants. Unlike conditions like lactose intolerance, infantile gastroenteritis, and allergic colitis, doesn't typically cause significant stress, weight loss, or systemic symptoms in the infant. Case number 5. A 7-year-old girl presents with acute onset of bloody diarrhea and abdominal pain. She recently returned from a camping trip. Stool cultures are positive for Shigella. Which of the following is the most likely diagnosis? A. Crohn's disease. B. Ulcerative colitis. C. Infection with enteric pathogens. D. Irritable bowel syndrome. The correct answer is C. The history of acute onset of bloody diarrhea and abdominal pain following a camping trip, along with a positive stool culture for Shigella, suggests an infection with enteric pathogens. Conditions like Crohn's disease and ulcerative colitis are chronic inflammation and don't present acutely following environmental exposure. Irritable bowel syndrome is a functional gastrointestinal disorder and doesn't cause bloody diarrhea or positive stool culture for pathogens. Case number 6. A 3-year-old boy presents with sudden onset of severe intermittent abdominal pain, vomiting, and a palpable sausage-shaped mass in the right abdomen. An ultrasound reveals a characteristic target sign. Which of the following is the most likely diagnosis? A. Appendicitis. B. Intestinal obstruction. C. Intussusception. D. Gastroenteritis. The correct answer is C. Intussusception is characterized by telescoping of part of the intestine into another, causing severe intermittent abdominal pain, vomiting, and a palpable abdominal mass. The target sign on ultrasound is diagnosed. It differs from appendicitis, which typically presents with more localized pain and fever, and gastroenteritis, which usually involves diarrhea and vomiting without the distinctive palpable mass or ultrasound finding. Case number 7. An 8-year-old girl presents with palpable purpura on her lower legs, abdominal pain, and arthralgia. She had an upper respiratory infection 2 weeks ago. Which of the following is the most likely diagnosis? A. Rheumatoid arthritis. B. Immunoglobulin A vasculitis. C. Kawasaki disease. D. Systemic lupus erythematosus. The correct answer is B. IgA vasculitis, formerly known as Hennig-Schönlein purpura, is a vasculitis that often occurs following an upper respiratory infection. It is characterized by tetrad of palpable purpura, abdominal pain, arthralgia, and renal involvement. The presence of palpable purpura, particularly in the lower legs, is a key diagnostic. The other listed conditions have different clinical presentations and don't typically present with this combination of symptoms. Case number 8. A 10-year-old boy of Mediterranean descent presents with periodic fevers, severe abdominal pain, and joint pain. He also has a history of unexplained rash. The symptoms seem to resolve spontaneously but recur frequently. Which of the following is the most likely diagnosis? A. Juvenile idiopathic arthritis. B. Crohn's disease. C. Familial Mediterranean fever. D. Hennig-Schönlein purpura. The correct answer is C. Familial Mediterranean fever is an inherited autoinflammatory disorder common in individuals of Mediterranean descent, characterized by recurrent episodes of fever, abdominal pain, joint pain, and rash. These episodes are self-limited but recur frequently. The periodic nature of the symptoms and the patient's ethnic background are important clues. Other conditions like juvenile idiopathic arthritis, Crohn's disease, and the Hennig-Schönlein purpura have different clinical features and don't typically present with recurrent fever and systemic inflammation. Thank you for joining us. Stay tuned for more pediatric case review.